welcome to Geriatric Mom. This one would be episode number 13. And this one is really going to be about C-section versus vaginal birth and kind of how they differ and, pros, cons of both because there obviously is, just to inform you and make you more aware of what those are. Again, my name is Natasha. I am your host. This is the show that helps you have a voice, real moms and dads sharing the unedited truth, finding joy in the chaos, and reminding each other we're all in this together. So I just think it's important, obviously, to educate. I feel like I wasn't educated and I did not know enough throughout the process to be prepared for what happened, right? And it took me a long time, literally up until the past few weeks to feel like I really processed that situation and am really aware of everything that happened and kind of why it happened. And it's a lot to process, so I think it's just the more that you can discuss and talk about it, the more we make it normal and it's okay to feel how you feel and just to be as educated as you possibly can. Once again, I am obviously not an expert. I did do my research on what I'm going to say, but always talking to your provider is going to be the best to discuss what's best for you and what's best for baby and for your family. So a lot of the information that I found was on Live Science and scholarly articles as well. Um, so I kind of just like split it 50-50, right? C-section versus vaginal birth. So with the C-section, to have that happen, they have to cut through 7 layers to be able to remove the baby. They cut through the skin, through the subcutaneous fat, the fascia, the muscle, the peritoneum, the uterus, and then the amniotic sac, which is where the baby is, and they are able to pull the baby out. So 7 layers, that's a lot. With a vaginal birth, you have to dilate to 10 centimeters to be able to deliver. Obviously, some women tear, and so that can kind of expand things even further, but 10 centimeters is when they give you the okay to push and to be able to deliver the baby. Generally, vaginal birth is considered safer, right? So that's obviously what our bodies are made to do, is to give vaginal birth. That's how it was supposed to be. C-sections are major surgery, so always more risk with that. Obviously, I just want to put this out there now. Whatever you have to do for you or your baby to be safe is what you need to do. I don't think classifying things as this is what I have to do or this is what I should do is appropriate, right? Because it's just the most important is that your baby's okay and you're okay. And it took me a long time, like I was saying, to process that and to really just feel at peace with that. So I'm just going to put that out there now. With C-sections, they can be scheduled. So obviously with vaginal birth, that's not the goal. It's just kind of spontaneous whenever your body decides that can occur. They are not emphasizing and really offering scheduled C-sections as often anymore because it isn't as safe. So, but they can be scheduled. C-sections lead to a longer hospital stay. Those can vary. I do believe it says in here it's like 48, 2 to 4 days is generally what happens with C-sections. We were out within like 36 hours, I think. They felt like I was doing well enough after the C-section that we could be discharged. And to be honest with you, I was just kind of over being there. We had been on there on Friday since Friday, and it was just we had been there for such an elongated time that It was just time to go home. With vaginal births, the the longest most likely will be 24 to 48 hours. Usually closer to the 24-hour time is what they expect. With C-sections, it's said that there's less pain. The way I was looking at it when I was doing the research is that yes, maybe there's less initial pain because you do have the epidural. They obviously numb you for the removal of the baby. Obviously, you don't want to feel that. So you don't feel any of that, but afterwards they consider the pain to be more severe than vaginal birth. Whether that's true or not, I think that can only be told by probably moms that have had both, right? That have had a vaginal and a C-section birth. I have nothing to compare it to, so I don't know what vaginal birth feels like. I just know after the C-section, the first few days weren't terrible, but day 4 I just remember was pretty rough. Felt like a lot of pulling and it was quite a bit of pain, but in general I didn't feel like it was anything like super crazy or intolerable. I didn't have to take any pain meds. If I really needed something, I think I took some Tylenol, but in general, didn't really need anything for that. And I know with vaginal, it kind of depends too, right? Like if you tear a lot, you might need a little bit more. You might need some pain meds. You might need more ice packs. I had all the things. I had gotten the bottles. I had gotten the ice packs that you could pop open. I mean, I had all the things. I was ready to go for a vaginal birth. So that kind of sucks, but they kind of vary, right? So I feel like that's opinion based and tolerance based of pain. So I don't really think it's fair to say, oh, C-sections are less pain or vaginal births are less pain or more pain or whatever the case may be, because I feel like that's kind of person to person. With C-section, you're obviously not going to have any vaginal tearing, so that can be a positive. But with C-section, like we talked about, you have 7 layers. They had to open me up more when I had my C-section because I did hemorrhage. So they kind of had to chase that bleed a little bit. So my scar isn't super small. It's definitely bigger and kind of goes from one side and generally to the other side as well. So it's pretty large, which to me, I don't, scars are scars. It is what it is. So that is one thing is they with C-section are not gonna get the vaginal tearing, which to me is a little less uncomfortable, right? That's your vagina that's sensitive, so maybe a positive. Um, with vaginal birth, you can still have all the things that you can have an epidural, you can do the nitrous oxide, which I did. I found that helpful until I got my epidural. You can do IV medications, you can take baths. I really loved being able to get up and move around until I got my epidural, which, like I've said previously, was not my goal to get the epidural, but that is what happened. But I loved moving around, and the bath was my favorite. It was so comfortable and cozy. I love baths in general, so it was really calming. My husband was in there with me every time I needed one. He definitely was with me. So that made it more cozy because he was just there working through everything with me and being super supportive. So just keep that in mind. If you do get an epidural, they make you stay in bed, and that's kind of the end of your moving around journey. So keep that in mind. Um, with C-section, a downfall is definitely no movement, like I was just saying. Multiple babies, it's good to have a C-section, so it's generally considered safer to have a C-section if you have multiples. So if you're just giving birth to one, that's definitely easier to make sure that they're head down, they're in the right position, everything's going okay versus monitoring multiple babies and trying to give vaginal birth to multiples. So C-section is definitely considered safer in most cases, not all cases, for multiples. With vaginal birth, you have the option of water birth, which is huge, right? I think that's great. Like I said, the bath was one of my favorite places to be, so if I could have had my choice and everything, would have went ideally, water birth would, I feel like, been right for me and been the best. Like I said, vaginal births, you can change positions. Um, for vaginal births, you can have the whole family there. You can have whomever you want in the room to be a part of that. So that can be really special if you want multiple people in there. Chris and I definitely kept it lower key. I only wanted one of my friends in the room. I really didn't want like a whole bunch of people or people that I just wanted to keep it low key, really. Just, one person and that was it, and she's one of my best friends, and she was there. I didn't end up being able to give vaginal birth, but she was there right after I got back from the C-section and got to hold my son and everything. C-sections, it can only be your husband in the room with you. So it was just me and then Chris, he had to get all gowned up and come down, and I was so concerned about him being in there because that has to be horrific to see, your loved one on the table and, just especially when it like becomes an emergency, like they literally rushed in and said, it's time. We need a C-section. Okay. So it was scary for everyone, right? So he's the only one that could be in there with me. No one else can be there. So with vaginal birth, you can have more people. That can be good, that can be bad, that can be what you want it to be, whatever the case may be. So I feel like that's different person to person, right? 2 in every 3 births is vaginal, so I feel like that's a very positive number that that many women can give vaginal birth. I think that's great. Obviously, in most cases, the more natural, the better that's gonna be for the mom and for the baby. Um, let's see. So, C-section is also good if you have certain diseases. So, certain things like HIV or herpes, things like that, they don't want those things to transfer to the baby. So, if you're like in an active outbreak of herpes, sometimes, they might recommend that. Or, if you have HIV, then most likely they're going to recommend a C section for you. I don't think I read anything that said otherwise because they can give you drugs to make that not pass HIV pass to the baby, but the mom is still obviously infected. So it's good that they have those things in place, and C-section is by far the safest route for those situations. With vaginal birth in general, it said the research that I did, there's less scarring, less bleeding. So that's always positives, right? With C-sections, the scars can be pretty large. They can be obviously hard for some women if that is something, that they value in themselves, and that's great if you do. And so those scars can be hard, they're numb. Like my scar, like I can't really feel like above or right below the scar, so everything's just kind of numb in that area in general. And it says sometimes that that can get better over time, but in general, not sure if it can. Obviously, with vaginal birth, that scarring can occur and usually occurs. They call them like they'll grade them differently. I think it's like 1 through 4, and based on how far you tear is, the grade that they give you. C-sections can be a harder recovery for moms. It can be really painful, and I've seen some women that have really had a really hard time with C-sections and recovering from that, but truly it's best, everything I read, to get up, start moving around as soon as you can. Obviously, use ice, use pain medications, but generally, really trying to get moving and get your body acclimated to that. You did have major surgery, so you have lifting restrictions. Pretty much, you can only lift the baby. You have to be careful bending. Like there is a lot of restrictions with it. Same thing with vaginal birth. You have to be careful as well. You don't want to push things too far. I don't feel like 6 weeks is enough for women. If that is all the time you can take, that's unfortunate, to be honest, because I feel like you really need that time to recover and heal your body. But if that's all you can do, that's all you can do, right? So I feel like the more that we can advocate for things, like in Colorado, we have FMLAI. I don't know other states that have that. I do know it is a thing in other states, but I was able to get 4 months because I had an emergency C-section, but all women get 3 months, which I feel like is great. 12 weeks, give your body time to heal, try to get, through some of those postpartum emotions, and then the fathers get it as well. So I think that's fantastic, right? So take your time. At first, when I first went on leave, I was a mental case. I was like, I can't do this. I'm trapped in my house. I don't know what I'm doing. I can't be a mom. What am I thinking? Hot mess, hot mess. By the end, I loved it so much. So, really, if you can use those resources, if you have them in your state, wherever you can, whatever you need, I'm happy to help you look, but definitely take your time and don't rush back into work if you don't have to, right? Obviously with C-section, there's less risk for like anesthetic reaction. So if you get an epidural, kind of pretty much same thing. I know that they give you some more meds. I would have to do more research to see what the difference is in the medications that they give you. But you can have more reactions because you are getting medications. So obviously, vaginal birth, you don't really, if you don't get those medications and you stick to certain things, you're not going to have those reactions like you might with a C-section. With C-section, you have the risk for pelvic adhesions. I did also find out I had this. I got my tubes removed. Chris and I just decided, we were so very lucky to have Odin. I'm 36, he's almost 40. We decided, we're on the older end for parents and definitely just how we feel. And we want to be able to take really good care of Odin. So I did get my tubes removed just to ensure because I figured, knowing my luck, I'll be like fertile myrtle afterwards. And we're not really looking to have more kids. If we were younger, we'd love to, but we're not. And so when I got my tubes removed, I have severe pelvic adhesion. So what does that mean? Means that my abdomen is full of scar tissue from the C-section. So my organs are actually sticking together. And I thought everything felt more painful because I got my period back pretty much right away. I know other moms said they don't get their periods back for 4 or 5, 6 month postpartum. No, I got mine pretty much right away. And it was insanely painful, which I have endometriosis, which is painful. And that on top of it, so much worse. So much worse. So just know that you do have the risks of pelvic adhesions and it just feels like everything's ripping out of your body. So painful, not fun. Definitely occurs with C-section, which it wouldn't in vaginal birth because they're not opening you up and messing with your insides. Um, less chance for infection with vaginal birth versus C-section. There is a higher risk of that. They really have to make sure that they clean everything out well. Same thing with vaginal birth, but there is a higher risk with C-sections. With C-sections, there is a risk of not enough oxygen making it to the baby. So that is a big concern as well. Odin had that issue. They do an APGAR scale and it's like 1 to 10. I do like 0 to 10. 0 meaning they're not alive and 10 just being like the best. And I think most babies get like an 8 is what I remember them saying. Odin got a 1. So he wasn't responding, he wasn't breathing, he had a heartbeat, like, he had nothing else. So they had to resuscitate him, which is scary as it can be. So he had a lack of oxygen, and, we're lucky that we did the C-section when we did because otherwise, who knows what would have happened. So with C-section, the risk of not getting enough oxygen to the baby is higher as well. Um, less breathing issues with vaginal birth. So I was reading that when you give vaginal birth, because obviously that's the more natural way to go, the baby goes through the vaginal canal and it compresses their lungs down and squeezes out like the fluids and all the bad things and everything. So it's part of the natural way of getting all those bad things out. So babies tend to have less breathing issues when they're delivered by vaginal birth. Whereas with C-section, that obviously doesn't happen. So they have to like manually suction the babies and do all of those things. So they have a higher risk for aspiration and getting fluids into their lungs. So I found that pretty interesting because I never thought about that. For for C-sections, they take about 45 minutes or less is what I found. They're quick, they're fast, they don't wanna be in there for long, it's major surgery, they don't wanna keep you opened up. With vaginal births, they can last it says the average birth, um, actual in labor is between 4 to 8 hours, so, obviously, a C-section is faster, vaginal birth takes longer. And some women are in labor for days, so keep that in mind as well. Some women give birth very quickly, and that's when you see the videos of women giving birth in their car. So it's different for everyone, but it does say the average is 48 hours, and for C sections, 45 minutes or so. With vaginal birth, it does say all women have an issue, like just from being pregnant, that they can have weakened bowel and bladders. With vaginal birth, the risk for your pelvic floor being weak is higher, so it's really important that after you give birth that you really try to do those exercises and really increase that pelvic floor because you run the risk of urinary incontinence, bowel incontinence, leaking urine. That's why you hear women say like, I peed when I laugh and, I've had this many kids and you can only do what you can because that's just kinda it happens, especially if you have multiple births, you're gonna have a weaker pelvic floor. There are exercises, there's physical therapists that can help, etcetera, so just keep that in mind, but the risk is less with, um, C-sections. It does say that your pain with C-sections can be extended, so generally, most women after a couple weeks feel better after vaginal birth. With C-section, that pain, like pretty severe pain from what I was reading, can last up to 2 months. So that's important to kind of keep in mind that that pain can last longer. And I know that some women even say that that pain has lasted years for them, whether that's just like the pain of pulling or that numbness feeling, I'm not quite sure, but that is things I was reading. With C-section, obviously, your increased risk for blood loss occurs and blood clots, so it increases both of those. You can hemorrhage, you can get clots, all of those things increase. After I had my C-section, I know that they were giving me ibuprofen, obviously, which isn't like a great blood thinner, but they did give me a couple injections for um why can't I remember it? I give this to people all the time. They gave me a blood thinner and an injection, so heparin. So they did give that to me after, birth, so I didn't have any issues with that, but that's definitely a concern after you have a C-section or any major surgery, that you could have something like that. Let's see. Pelvic organ prolapse can happen with vaginal birth. The majority of the time, it looked like that happens as well after multiple deliveries, but obviously, your risk of that just increases. So, that's literally when your uterus can come through your vagina. Generally, I've only seen that happen in older people, but I could see it happening to someone that's younger or that's had like a pregnancy with multiples or something. So just something to keep in mind and be aware of. If that does happen, you obviously need to call your provider right away. With C-sections, your chances of dying from birth increase by 3 times from vaginal birth. So, if you have a C-section, your chances of dying are 3 times more likely. So that's scary. C-sections are obviously more complex with like the risk for infection, anesthesia, major surgery, the way they remove the baby, baby's life, mom's life, everything's more complex versus the vaginal birth in general. Obviously, the pain from your perineum and everything can be pretty severe, especially if you tear. Like we were saying before, stage 1 through stage 4. Stage 1 is just like a minor tear, and all the way to stage 4 is like when you tear all the way to your anus. So they do suture you, they do fix that, but I could see that being a very painful experience. So good to have those things on hand and really watch those videos that they show. I had all the things on hand, like the witch hazel, the foam, the everything you can think of, because I thought that's the route I was going. So just really watch those videos and prepare yourself for that so that you have all those things on hand. Even after a C-section, the diapers, helpful. I know that's not what they're called like adult pull-ups, but super helpful. I wore them all after my C-section, just super helpful, and I really don't love pads and things like that, but definitely super helpful, and you can't obviously wear tampons after a C-section or a vaginal delivery. So have things like that on hand is super helpful. Um, Risks for the baby from having C-section, obviously issues with baby breathing. The baby can be cut. That would be horrific. Obviously, they can't be perfect all the time. Surgeons are great, but things do happen. So that is a risk that they could cut the baby trying to get through all 7 layers to get your baby out. They could nick one of your organs, so that could cause a whole nother issue if everybody's anatomy is different, right? Things are supposed to be where they're supposed to be, and sometimes that just doesn't happen. So there is a risk that they can nick other organs when they're trying to do a C-section as well. Risk with vaginal birth, large babies. We talked about that kind of in some previous episodes. Large babies can obviously, that doesn't always work with vaginal birth, so important to keep that in mind that that might lead to a C-section or it might lead to, that stage 4 tearing. So, they're not always right when they guesstimate the size of the babies based on what they were saying. Odin was going to be a huge baby, and he ended up being 7 pounds 1 ounce, and they lose some ounces when you're in the hospital. So, but based on the way they were saying he was going to be ginormous, and he didn't end up be. So not always completely accurate, right? With vaginal birth, we already kind of discussed that. Um, the large baby issue, but with that, they can cause longer births. And sometimes with vaginal births, if the baby is in the wrong position or they're trying to get the baby out, say the baby gets stuck, they're trying to get that done, they can actually break bones by accident, dislocate shoulders. Sometimes those things do happen when they're trying to remove the baby. So, just an FYI, it didn't look like that was very common, but that would be super scary if that happened. Um, so I did talk about this in my last episode as well. They don't love if you have a C-section and then want to have a vaginal birth because of the risk for rupture. Um, and that rupture would occur where your scarring was from your C-section. So I think that's important to keep in mind if that's something you're willing to wish to give vaginal birth. To be honest with you, if I was going to have a second kid, I'd really want to try for that vaginal birth. So I feel like that's up to you and your what you decide to do, but that is the risk for that. Obviously, a lot of this has to do with how the baby's positioned, what risk factors you have, what risk factors the baby has. Um, if they're obviously with the C-section, increased risk of blood loss, infection, rupture, if you've had a C-section before. Like I said before, they're offering the scheduled C-sections less. So, vaginal birth, they are trying to, emphasize more. And a lot of this is just really so you can be well informed on your decision and what you're most comfortable with. Again, the best case scenario is that the situation is safe for you and that the situation is safe for baby. So in the end, I truly feel like that's all that matters, but I do also know how it feels to, want a certain thing and then not to be able to do that certain thing like you would like. So I think that's a lot of the information I have for C-section versus vaginal birth. Obviously reach out to your provider if you have more questions or things you want to discuss. If you want to reach out and share a story, I'm always happy to listen and discuss with you. I am on TikTok, I am on Instagram, I'm on Facebook, I'm on YouTube. I have my own website, www.geriatric.mo or www.geriatric-mom.com. There is a contact form on there. I'll get an email if you want me to reach out to you. Happy to do so. I'm also on Spotify if you'd like to watch videos or just listen to the podcast. But definitely would love to hear your stories and your thoughts as well. Again, this is Geriatric Mom. I'm your host, Natasha. Thanks for listening.